myself Vaishnav Hore. Today I am going to discuss about ethyl alcohol and methyl alcohol. In this topic, we are going to cover toxicity of alcohol, clinical uses of alcohol, aldehyde dehydrogenase inhibitor, and methyl alcohol. Guidelines for safe drinking. On an average, 1 to 2 drinks per day is usually safe. Not more than 3 drinks on any one occasion. Consumption of greater than 3 drinks per day is associated with adverse health effects. Safe limits somewhat lower for women than for men because metabolism of alcohol is slower in women than in men. One drink is equal to 50 ml of spirit is equal to 150 ml of wines is equal to 400 ml of beer. Toxicity of ethyl alcohol. Side effect of moderate drinking. Nausea, vomiting, flushing, hangover, traffic accident. Acute alcoholic intoxication. Unawareness, unresponsiveness, stupor, hypotension, gastritis, hypoglycemia, respiratory depression, collapse, coma, and death. Treatment of acute alcoholic intoxication. The first priority is to maintain patent airway. Tracheal intubation and positive pressure respiration may be needed if it is markedly depressed. Induction of vomiting, gastric lavage with sodium bicarbonate, IV sodium bicarbonate to correct the acidosis, maintenance of fluid and electrolyte balance. Correction of hypoglycemia by glucose infusion. Thiamine 100 mg in 500 ml of glucose solution is infused IV should be added. Recovery can be hastened by hemodialysis. Chronic alcoholism. First, tolerance. On chronic intake, tolerance develops to a subjective and behavioral effects of alcohol but is generally of low degree. Second, dependence. Psychic dependence occurs only on heavy and round the clock drinking if alcohol is present in the body continuously. Then withdrawal syndrome. When a physically dependent subject stops drinking, withdrawal syndrome appears within a day. Its severity depends on the duration and quantity of alcohol consumption. It consists of anxiety, sweating, tachycardia, tremor, impairment of sleep, confusion, hallucinations, and collapse. Treatment of chronic alcoholism. First, social and motivational therapy. Second, substitution therapy with benzodiazepines such as long-acting diazepam. Third, naltrexone. Naltrexone is a long-acting opioid antagonist. Several studies have demonstrated involvement of opioid system in the pleasurable effect of alcohol through the dopamine-mediated reward function. It helps to prevent relapse of alcoholism. It reduces alcohol craving, number of drinking days, and chances of resumed heavy drinking. Fourth, acamprostate. It is weak NMDA receptor antagonist with modest GABA A receptor agonist activity. It is being used in UK, USA, Europe for maintenance therapy of alcohol abstinence. Clinical uses of alcohol. Alcohol is used as antiseptic, rubefacient, and counter-irritant for sprains, joint pains, etc. Alcohol is rubbed into the skin to prevent bed sores. Alcoholic sponges are used to reduce the body temperature in fever. Intractable neuralgia, severe cancer pain. Injection of alcohol round the nerve causes permanent loss of transmission. Alcohol is also used to ward off cold. Is also used as appetite stimulant and carminative. Reflux stimulation in fainting and hysteria. And last is to treat methanol poisoning. Then aldehyde dehydrogenase inhibitor. Disulfiram is the aldehyde dehydrogenase inhibitor, which inhibits the enzyme aldehyde dehydrogenase. When alcohol is ingested after taking disulfiram, the concentration of alcohol in the tissues and blood rises, and number of highly distressing symptoms are produced like flushing, burning sensation, throbbing headache, perspiration, uneasiness, tightness in the chest, visual disturbances, mental confusion, postural fainting, circulatory collapse. All these side effects are due to acetaldehyde in the tissue. Disulfiram aversion therapy is indicated in subjects who sincerely desire to leave the habit. After making sure that subject has not taken alcohol in past 12 hours, disulfiram is given at a dose of 50 mg per day for 1 week followed by 250 mg daily. Then methyl alcohol. Methyl alcohol is also called methanol and wood alcohol. Methanol is metabolized to formaldehyde and formic acid by alcohol dehydrogenase and acid dehydrogenase respectively. Methanol toxicity. Toxic effects of methanol are largely due to formic acid. A blood level of greater than 50 mg per dl is associated with severe poisoning. Manifestation: vomiting, headache, epigastric pain, uneasiness, drunkenness, tachypnea, bradycardia, hypotension, delirium, seizures, disorientation, acidosis, retinal damage, coma, and death are the some manifestations of methyl alcohol poisoning. Treatment of methanol poisoning: keep the patient in quiet dark room, protect the eyes from light, maintain the ventilation and BP, gastric lavage, IV sodium bicarbonate, caseal infusion, hemodialysis, ethanol, fomepizole. Fomepizole is a specific inhibitor of alcohol dehydrogenase. Then let's going to discuss about some MCQ. First MCQ. Disulfiram acts by inhibiting the enzyme option A alcohol dehydrogenase, aldehyde dehydrogenase, option C MAO-B, option D lactic dehydrogenase. Here the answer is B aldehyde dehydrogenase. Second MCQ. Which of the following is the specific inhibitor of alcohol dehydrogenase? A. Fomepizole, B. Disulfiram, C. Acamprosate, D. Naltrexone. Here the answer is option A. Fomepizole. MCQ number 3. Content of alcohol in the spirit is option A 40 to 50%, option B 3 to 6%, option C 20 to 30%, option D 16 to 22%. Here the answer is option A 40 to 50%. Fourth MCQ. Toxic effect of methanol are largely due to option A formaldehyde, option B acetaldehyde, option C formic acid, option D acetic acid. Here the answer is C formic acid. Fifth MCQ. The combination of alcohol and disulfiram result in nausea and hypotension as a result of accumulation of which product? Option A acetaldehyde, option B methanol, option C NADH, option D acetate. The answer is acetaldehyde. Option A. Thank you.